Greetings, I'm the dentist. In our DENTAGENDA, we will be continuing the second chapter, Preventive and Community Dentistry. These are the points included in this chapter video series, and in this tutorial you will learn about dental health education. Starting with a general overview about the topic. What is dental health education? The objective of dental health education is to influence the attitude and behavior of the individual to maintain oral health for life and to prevent oral diseases by primary prevention, secondary prevention, and tertiary prevention. Primary prevention seeks to prevent the initial occurrence of a disease or disorder and is aimed at healthy individuals. Secondary prevention aims to arrest current diseases through early detection and treatment. Tertiary prevention helps individuals to deal with the effects of the disease and to prevent further complications or reoccurrence of the existing disease. Who would give the oral and dental health advice? Well, in fact, all health professionals should give it and explain it to the patients. But in practice, it had been shown that many patients relate better to advice from a hygienist or a nurse. It's important that the information given to the patient is factual and that different sources do not give conflicting advice. In order to unify the profession's approach, the Health Development Agency published a policy document laying out 4 simple messages, which are still recommended. Number 1, restrict sugar-containing foods to meal times only. Number 2, attend the dentist regularly for checkups. Number 3, clean teeth and gums thoroughly with a fluoride toothpaste. And number 4, water fluoridation is beneficial. The way in which the advice is imparted is as important as its content. And to achieve that, there are 3 main routes. Number 1, the mass media. This is an expensive alternative, and while commercial advertisers tempt the consumer, the success of a dental health education message, which is exhorting the public to stop doing something they find pleasurable, is not guaranteed. Number 2, community programs. These need to be carefully planned, targeted, and monitored. And number 3, the one-to-one method. In the clinical environment, this is usually the most successful approach because the message can be tailored to the individual and reinforcement is facilitated. However, it's expensive in terms of manpower. Because many patients find the dental surgery threatening, it might be better to choose a more neutral environment, like a dental health or preventive unit. It's important that the information is given by someone the patient trusts and can relate to. This might not always be the dentist, maybe the hygienist or the nurse. It's also important to have adequate time, as a hurried approach is not valuable, and to choose words that patient can understand easily. The following one-to-one approach has been used successfully. Define the problem and its etiology. For example, poor oral hygiene which has resulted in a periodontal disease. Is it because the patient lacks motivation or the appropriate skills? This stage includes questioning the patient to discover how often and for how long they brush. Set realistic objectives. It's better to start with trying to motivate the patient to brush well once a day rather than teaching them how to floss. Demonstrate on the patient, as this makes the advice more relevant and more likely to be remembered. Monitor by comparing black scores before and after cleaning. Using black disclosing tablets will make it even more motivating, as we have explained before in a previous tutorial. This not only enables you to monitor improvement, but also allows improvements in the patient's oral hygiene behavior to be reinforced. Remember that everyone responds well to praise, so if a patient is doing well, tell them. These are the keys to successful dental health education. Keep the information relevant to the individual and their lifestyle and problems. Keep the message simple. Too much information may be counterproductive. Repetition of the message, positive reinforcements. Now to the provision of dental care. Dental care delivery. General dental service is the main source of dental care for the majority of population, whether national health services or private. Salaried dental community service and community dental service was formed from the school dental service, and it has expanded over years to cover the following: provision of oral health promotion, treatment for patients for whom experience difficulty obtaining treatment or whom there is evidence that they would not otherwise seek treatment, like patients with special needs. Provision of treatment which may not be generally available in general dental services. Dental health screening of children in schools and other vulnerable groups with particular special needs. Epidemiology to assist the planning of local health services and as part of coordinated national surveys. Two factors affect the gaining of dental care: the availability and accessibility of dental services. Research shows that a greater proportion of public visit the dentist regularly where the dentist-to-population ratio is high. This ratio tends to follow a geographical pattern. And number two, social class affects both the incidence of dental disease and the uptake of dental care. Interestingly, the differences in caries experience between the social classes are much lower in fluoridated regions, because dentists have traditionally preferred to practice in leafy suburbs rather than poor inner city areas. These effects are often compounded. Moving to the barriers to the uptake of dental care. Aside from the problems experienced by patients accessing dental care, research has shown that two main barriers to regular uptake of dental care are anxiety and cost. Anxiety is manifested as fear of pain or particular procedure, or feeling vulnerable by giving control to the dentist to access the sensitive area of the mouth. A patient's first impressions are important, as the reception they receive from the staff and the environment in which they wait to be seen. These all could either allay or reinforce their anxieties. The attitude of the dentist is also a significant factor. A good dentist has a friendly personal touch and explains what the treatment is going to involve. The cost. Cost perception still exists that dental treatments are expensive. Patients often find the way in which charges are calculated is confusing, but they welcome an estimate of the cost prior to the treatment. Furthermore, the pattern of attendance varies throughout life, with children now enjoying a visit to the dentist, but adolescents breaking the habit of regular attendance due to other pressures in their lifetime. A return to the dentist may be triggered by pregnancy and desire to provide a good example to the children, or there is an urgent need for treatment and the fear of becoming edentulous. And there you have it all. Thank you for watching. Don't forget to subscribe. I'd like to have you here for more videos. And follow us on Instagram at DENTAGENDA for extra tips and tricks.